Assalamualaikum warahmatullahi wabarakatuh. My name is Elvira Apsari Putri from Poltekkes Kemenkes Bandung. I want to present nurse documentation to patients with body image disorders.
The diagnosis is body image disturbance. The case is a patient named Mr. J who was diagnosed with diabetes mellitus 4 years ago. There was a wound on his left leg that didn't heal, so it needed to be amputated by doctor. The patient is ashamed of his current state. Patient and complaints details. The name is Mr. J. He's male. His age is 65 years old and ethnicity is Japanese. For presenting complaint, he felt ashamed because his left leg was amputated because of diabetes mellitus. History of presenting complaint. 4 years ago, he was diagnosed with diabetes mellitus. His leg had a wound that would not heal and rot, so the doctor had to amputate his leg. For review of organ system, vital sign, blood pressure 120 per 80 millimeters mercury, pulse is 80 per minute, respiratory rate 20 per minute, and temperature is 36 degrees Celsius. Next, past medical and surgical history. His social history. Meaningful person is his son, daughter, and grandchild. The patient's wife died 5 years ago, but he said he still loves her very much. The participation in group or community activities. Before getting sick, the patient always took part in gymnastics at home and went fishing with his friends. The patient said that he always gathered to watch football matches with his neighbors. He always plays with his grandchild. Next, medication history. The patient is always taking medicine for his illness, but the patient said that sometimes he felt lazy to follow the food recommendation from the doctor. The patient has no allergies. Next, sexual history. Patient was married, but his wife died 5 years ago, and he said he still loves her very much. Next, details from a physical examination. Subjective data. The patient says he is embarrassed when his neighbors or relatives visit him. The patient says he is ashamed to have one leg. The patient said he was afraid and his grandson would be ashamed to have a disabled grandfather. Next, objective data. First, the patient always covers his feet with a blanket. The patient always refuses when the nurse wants to see the condition of the surgical wound on his leg. The summary assessment. The problem is the patient is ashamed of his current situation because his left leg is amputated. The etiology is disturbed body image due to loss of body structure change. The symptom is body image disturbance. Next, plan. Therapeutic plan is coping support, role performance support, need disclosure support, support expression of feeling, self-responsibility support, distraction technique, guide imagination technique, and stress management. For education plan, body image promotion, self-care education, adaptation engineering education, hope promotion, and self-confidence promotion. Next, collaboration plan. First, diversional therapy and behavioral cognitive therapy.